So, Chris, what is Klumpke's palsy and how does that occur?
Well, Klumpke's palsy is injury to the nerves in the neck, and it most commonly occurs during labor and delivery. Something will happen where the baby gets stuck during delivery, and so the baby's head will be outside the birth canal, but the rest of his or her body will still be stuck in the birth canal, and really can only occur one way, and that is if the doctor, in trying to get to deliver the rest of the baby's body out of the birth canal, either pulls too hard on the baby's head and neck, or pushes down, or in a bad, so it's pushes down in such a way that it causes stretching of the nerves in the neck.
So this causes an injury to the baby when it's being born.
Yes, it's a birth injury that results in injuries. Even though it happens to the nerves in the neck, it actually results in injuries, most commonly to the baby's arm or hands.
What are some of the most common allegations of malpractice in a Klumpke's palsy case?
There's two main allegations. One is that the baby gets stuck like that. It's a couple of things. One, the baby could be in a breech position or an abnormal position coming through the birth canal. So then the baby gets to the entrance of the birth canal, gets stuck. So it's a failure to recognize if the baby's in a breech and can't deliver vaginally, then the doctor should do a C-section. So be a failure to recognize that. And the second thing would be that if there wasn't any reason to anticipate the baby would get stuck, that once the baby is stuck, then there's a series of maneuvers that doctors are supposed to be trained to do to deliver the baby, and not so that there's not excessive force put on the baby in that situation. And I did mention before, but one other way that excessive force gets put on the baby in that situation is the doctor tries to deliver using forceps.
Can you talk a little bit more about that? What the issue is with forceps?
Yeah, well, the forceps is now you're introducing kind of an artificial way to deliver, and you could put a lot more force on the baby's head and neck with forceps or mechanical force that then you could just using not using something mechanical like that and just using the natural forces of labor. So it kind of if the baby does get stuck, and something called shoulder dystocia, if that happens and you use forceps, it just increases the risk that you can get a Klumpke's palsy.
Is there any issue with like a misdiagnosis or a delay in diagnosis or treatment of Klumpke's palsy? Is it something that would be obvious as soon as it happens, or is it something that kind of the signs of that it has happened show up later after birth?
If it usually doesn't show up right after birth, but there's no real issue with a delay in the diagnosis because it is something that's normally not diagnosed right away. But the baby's arm will be limp, and so as you can imagine, with the baby, you're not always going to recognize that right away. But one of the ways, in severe cases, one of the ways to treat a Klumpke's palsy is with surgery. And anytime you're treating nerves, the sooner you can do it, the better the higher the likelihood that get a good result. So, but it's not something right away, but something in the first few weeks, or months of life should be recognized and treatment options considered.
Can Klumpke's palsy lead to really long-term complications for the baby?
Yes, it can. And in severe cases, it can result in deformity of the arms and hands. The child will have claw hands and only be able to hold their arms in a certain way, or they may have paralysis of an arm. So yeah, it can have some devastating consequences to the baby throughout their life.
So, what are some of the key elements that a plaintiff needs to prove in a Klumpke's palsy, malpractice lawsuit in order to, win a lawsuit like that?
Sure. There's two main elements. One is, should the doctor have recognized that there was a likelihood of shoulder dystocia? Things I mentioned before. Was the baby going to be large? Was there, disproportion between the size of the baby and the size of, the mother's pelvis? Did the mom have difficult deliveries prior to this? And then the second thing would be, if there was shoulder dystocia, did the doctor use excessive force? So what maneuvers he used, how he tried to deliver the baby. Those are the two big things.
And then what are the potential outcomes of a Klumpke's palsy malpractice lawsuit, including damages or potential, maybe even potential changes in medical practice and things that, doctors might do differently in the future?
So the types of compensation that are recoverable in a Klumpke's palsy lawsuit are the cost of future care for the child and for the lifetime. Any kind of aids or devices that will assist. If the person is not able to use their arm because of Klumpke's palsy, there are adaptive devices they'd be able to use. If it would obviously cause a limitation on the earnings that the person could have, the types of jobs, the type of work they could do if they could only use one arm. So you can recover for any kind of reduced earning capacity over the person's lifetime. Pain and suffering, uh, and the damages would be for both the child and the parents, who are raising the child. So and we hope that in every case, when you hold the wrongdoers accountable, that it does change the way doctors approach that situation in the future.